عليكم السلام دكتور.
Okay, so today we'll go to the second chapter. So we'll talk about the skeleton. Skeleton. Okay. So in this we'll try to understand what are the two types of skeleton. Skeleton are of two types, or two parts, or subparts we can say. It is the axial and appendicular skeleton. Okay. So what is this axial and appendicular skeleton? We'll talk about that. So here in this, if you see, the skeleton system is divided or consists of the bones with ligaments and cartilage and joints. Together, all this together will form the skeleton, or it is also called as the skeletal system. So skeletal system is made up of bones, mainly of the bones. There are almost, in case of adults, there are 206 bones. In case of the adult, there are 206 bones. So this is the main component of the skeleton system. It is called a skeleton because it is made up of bones, almost 206 as I said in case of adult. Along with this bones, there are also something called as ligaments and cartilages. Okay. And whenever the two bones come together, then it is called as joint. Whenever two bones come close together, then it is called as joint. Okay. So skeleton system is made up of all these bones, ligaments, cartilage, as well as joints. We'll study them one by one. Okay. Then this skeleton system is divided into two types, as I said before, axial skeleton as well as the appendicular skeleton. So what is this axial skeleton and appendicular skeleton? Before we go to the axial and appendicular skeleton, we should know what is the function of the skeletal system. So what are the functions of the skeletal system? Why we have the skeletal system? One is it is the main structure which will support the whole of the body. If not, the body will be made up of just muscles and tissue and it will all collapse. Okay, so this will support for the attachment of muscles. It provides solid axis for muscles to act against, creating motion. So this is very important structure on which the muscles act. So whenever the muscles contract, so there will be a movement in the bone. So it will give a solid axis for the muscles to act. Then it also helps in protection. First is support, the second is protection. Especially in case of the brain. Brain is a very sensitive organ. So it is supported or protected by a multiple bones called as together it is called as skull. Skull provides barrier that protects the brain from external forces. So skull, again we'll study them the skeleton later. So it is made up of many bones, almost 22 bones. So all these bones together will form a protective covering around the brain. So it will form a barrier that protect the very sensitive structure called as brain from external forces, external injuries. So that is the function of the skull. Similarly, there is extension of brain called as spinal cord that is also protected by many bones. They are called as vertebrae surround and protect the spinal cord. So these vertebrae will form the backbone. Backbone. Okay. So it is also called as the vertebral column. Many vertebrae together they form the vertebral column. So which will again protect inside the vertebral column. There will be the extension of the brain that is called as the spinal cord. Then similarly, brain after the brain and spinal cord, the third important structure which is very sensitive and should be protected is the heart and the lungs, which are present in the thoracic region. So the heart and lungs are protected by again ribs. Together it forms a thoracic cage. Cage. Cage means just like the birds are put in a cage, the barrier within which it is protected. Similarly, the heart and the lungs are protected by being within the thoracic cage. So thoracic cage is made up of ribs. Okay, that will protect the heart and the lungs in the thoracic region. Then the third important function after the support and the protection by the skeletal system, the third important function it does is hemopoiesis. Hemopoiesis means production of the blood cells. That is called as hemopoiesis. So it takes place mostly in the red marrow of the bone. So there are two type of marrows, white marrow and red marrow inside, or it is also called as the yellow marrow and the red marrow. Okay, so that is the site where the blood cells are formed. The blood cells are formed within the red marrow, which is deep inside the bone, within the cavity of the bone. Okay, so it helps with the hemopoiesis, that is production of the blood cells. The fourth important function is mineral storage, especially the calcium. So the calcium is stored within these bones, which will make the bones hard and strong. So that's why this acts as the storage for the minerals. The fifth important function is it helps in movement of the body. Only when there are bones, then there is movement. Okay, so movement, it provides, the bones provide the site for muscular attachment, as we saw. So the muscles are attached on the bones. The bones and muscles together work together as a simple mechanical lever system to produce movement. So for movement to take place, there should be bones as well as muscles. If only bones are there, that is also not sufficient. Even if only muscles are present, it is not sufficient for movement. So there should be bones with the attached muscles over it, which will help in the movement. So whenever the muscle contract and relax, there will be movement at the joint. So these are some of the important functions of the skeletal system. One is it supports, two it protects, the third is it helps in production of the blood cells, that is called a hemopoiesis. Then the fourth function is the storage of minerals, especially the calcium. And the fifth function is movement. So these are the five important functions of the skeletal system. Now we'll study the bones. As we saw, the skeletal system, it is made up of bones. The main structure within the skeletal system will be the bones. So as I said before, the bones are divided into different parts. There are bones within the skull. There are 22 bones which will form the skull, which will protect the brain. So there are 22 bones within the skull. Then within the ear, small bones are present within the middle ear. Then in the neck, there is one hyoid bone. Then the backbone is made up of 26 vertebrae. Okay. Then there are 25 bones within the thoracic cage. That is, there are 12 pairs of ribs. 12 plus 12, right and left, they are called as pairs. So 24 bones, and then in the front there is one sternum, which together will form the 25 bones within the thoracic cage. Then there are four bones within the pectoral girdle, which will be the clavicle and the scapula on both the right and left side, will form four bones. Then there are 60 bones in the upper limb, 30 on right and 30 on the left. So totally 60 bones. Then similarly, there are 30 bones in the lower limb right side and 30 on the left side. Together it becomes 60 bones in the lower limb. Then there are two bones in which will form the pelvic girdle. We'll see all the structures one by one. So totally all these bones together they form 206 bones, 206 bones in all. Okay, within a human being, in an adult human being, there will be 206 bones. 206 bones. Now coming to the types of bone. Bones which are present in the body, they are not similar, but there are different types of bone within the body. So what are the different bones? So Bones are classified into long bones like this, like the bones of the upper limb and lower limb. This is the femur long bone. This is the example of the long bone. Then we have the short bone. Just opposite to the long bone, there are short bones, which are very small bones like the pisiform carpal bone, short bones. Okay. Then there are flat bones which will form the skeleton, the skull, sorry. So which will form the skull. Those are called as flat bones. Okay. So this is one of the bone of the skull. Okay. So this is the parietal bone. Then there are some bones which do not fit into any of them. Then they are neither long, they are not short, they are not flat. So they are called as irregular bones. Like this is the sphenoid bone, which is the best example for the irregular bone. These are the four different classification of the bones. Okay, four types within the bones. So we'll see one by one which are these bones. The first bone is the long bone, found in the limbs. As I said, in case of the upper limb, hand everywhere. Similarly, in case of the lower limb, we find these kind of long bones. Okay, so this is the bone of the arm. This is called as the humerus. Here we saw this is the femur. Now what we are seeing is the humerus. This is the bone of the upper limb. This is the bone of the lower limb. Both are long bones. Found in the limbs. Each bone is made up of the body, which is called as the diaphysis. Diaphysis. The middle part, this is called as the diaphysis. Okay. Then two ends called as the epiphysis. This is one epiphysis. This is the second epiphysis. So diaphysis at the center, middle part, the body of the bone, and the two ends are called as the epiphysis. And if you cut and open, then you see that the wall consists of dense tissue. So we have cut the bone into two equal halves. Then you can see this is the thick bone here. This is called as the compact bone, dense tissue. The central canal, medullary canal is filled with marrow. If you see at the center, there is a space, okay, filled with this red marrow. So this is the site where the blood cells are produced. So this is the red marrow which is present within the medullary canal. This canal, the space inside, that is called as the medullary canal, filled with marrow. The examples, as I said, this is the humerus here, and the femur, which we saw before. This is the femur. So these are two best examples. There are all other bones of the upper and lower limb, like the radius, the ulna, the tibia, fibula. All these are the long bones. Now coming to the short bones. What are the examples of the short bone? The best example for the short bones are within the hand here. So these are called as the carpal bones, found in the skeleton where strength, compactness, and limited movements are decided. These are the sites where they will be present, these short bones, where found in the skeleton where there is strength, compactness, and limited movement are desired. Two main examples will be bones of the wrist. So these are called as the carpal bone. Similarly, in case of the lower lower limb, within the bones of the ankle, these are called as the tarsus. Tarsus. These are the carpus or carpal bones, and these are called as tarsal bone or tarsus. So these are the best examples for the short bones. So here you can see these are the carpal bones. Now coming to the third type of bone, this is called as the flat bone. Flat bone. Okay, so flat bones are present mainly in the skull. This is the skull made up of flat bones, thin, flattened, and often curved. If you can see here, these bones are curved. Okay, so these are called as the flat bones, which are thin, and inside there is a big cavity where the brain is present. So it will be protecting the bone, protecting the brain. So these are called as flat bones, which are mainly present in the skull. They are thin, flattened, and often curved, used in sports where protection or muscular attachment is desired. Okay. So where the protection, so these skull bones are protecting the brain. So wherever the protection is necessary, there they are present. As well as muscular attachment, there will be muscles attached around. Okay, that you will study later. So so it will give both attachment to the muscles, that is one of the function of the bones, as well as also protection. Okay. So flat bones are especially present in the skull, where they will protect as well as give attachment to the muscles. So these contain red bone marrow. This is the site where the red marrow is for the long duration and present, always present most of the years of life. Okay, so it will be present in all these flat bones, especially the site where the red marrow is present. Example is bones of the skull. As you can see here, these are the bones of the skull, as well as scapula. Scapula is the bone of the back attached to the upper limb. Okay, we'll see that later. Okay, so these are the best examples for the flat bone. Now coming to the irregular bones. So irregular, as the name indicates, it is not regular. So that is called as irregular. Bones which don't fit into any other category due to irregular shape. So they don't have the specific shape. So they are called as irregular bones. The examples are vertebrae. As you can see, vertebrae is not shown here. So this is the sphenoid bone. This is the sphenoid bone here. Then so this is present in the skull, but in the base of the skull, this is sphenoid bone. Then this is called as the hyoid bone, which is present in the neck. Independent bone, which is not attached to any other bone. So this is called as the hyoid bone. Hyoid bone and sphenoid bone, you can see here. Vertebrae we'll see later. Okay. So these are the best examples for the irregular bones. Now coming to the sesamoid bones. Okay, sesamoid bones found in the tendon of the muscles. If you see here, this is the muscle here. So in the tendon, the ends of the muscles are called as tendons. Okay. So on the tendons of the muscles, there will be small bones. These are called as the sesamoid bones found in the tendons of the muscles. They improve the tendon pull and prevent friction of the tendon with the bone. The best example is the patella. So if you see here, so this is called as patella or patella, whatever you call. So this is a very good example of this is the largest small bone. Okay, what is the function? They improve the pull of the tendon. So here is the tendon with the muscle. So they improve the pull of the tendon as well as prevent friction of the tendon with the bone. So if there is no bone here, if the muscle is passing, it will rub the adjacent bone and there will be friction. So it prevents friction. That is a function of the small bones. Now coming to the axial skeleton. Okay, now we'll see what exactly we mean by axial skeleton. Axis means at the center. So whatever bones are at the center, they are called as the axis, axial skeleton. Okay, so axial skeleton, which is shown in blue color here. So this is the axial skeleton. So this axial skeleton consists of the skull. So the skull is the axial skeleton. Then the hyoid bone in the neck we already saw. Then this is the thoracic cage made up of ribs and the sternum. Okay, ribs and sternum will form thoracic cage, and from behind there will be the vertebrae here. So all these are in the midline, in the center, so that's why they are called as the axial skeleton, axis. Okay. Now coming to the first axial skeleton, the most important bone, that is called as the skull. So the skull, if you see the skull, so this has two parts. One is called as cranium, also called as the cranial bones or the cranium, which will be around the brain. So it encloses the cranial cavity inside the skull. There is cavity for the brain, that is called as cranial cavity, which supports and protects the brain. So that cavity will protect as well as support the brain. Also, it gives attachment site for some head and neck muscles. So it will also give the skull, all like all other bones, the skull bones also give attachment to the muscles of the head and neck. The remaining part of the skull is called as the facial bones. The bones which are in the face, they are called as the facial bones. So there are two parts within the skull. One is the cranial bones are called as cranium, which will protect the brain, and the bones which are in the face, these are called as the facial bones. So anterior aspect of the skull, which will be forming the face. So they form framework of the face. The facial bone will form the framework of the face. So it will give the shape to the face. Forms cavity for sense organs of light, taste, and smell. So these facial bone will give protection to the organs of light, like the eyeballs. So the eyeball is protected, so that is called as the organ of the light. Then taste, that is the tongue, which is protected within the oral cavity, and smell, that is for the nose. So all these three organs are well protected within the cavity of the skull, of the facial bones. So the facial bones provide opening for passage of air and food, as we know. So it will give passage for the air and food. Air through the nasal cavity, it will form the nasal cavity through which the air is passed, and for the food, which will pass through the oral cavity. So it will provide two important cavities. Then it also holds the teeth, which will help in chewing. So it will also hold the teeth, which will help in chewing. And it anchors the muscles of the face. So it will give attachment to the facial muscle. There are many muscles within the face, which will help in the expression, movement, for smiling, for being sad, frowning. All those are done by the facial muscles. So facial muscles attached to the bones of the face. Now here you can see the cranial bones, which will form the cranium. That is here. This is called as the frontal bone. This is the parietal bone. This is the occipital bone, and on the sides, on either side, it will be the temporal bone. Okay, so all these bones form these cranial bones. Okay, so here from behind, this is a picture shown. This is the occipital bone, and here there are a pair of parietal bones on either side. All these bones are in pairs except the occipital bone. Now, if you cut the skull and see inside, then you can see this is the cranial cavity. This is the base of the skull, and you can see this is the space inside. This is called as the cranial cavity. And within that, there are very important structures which you will study later in the next block. Here we will not go into details about these openings. There are many important openings. Okay. Now coming to the base of the skull, this is the picture seen from inside after cutting the skull. Now this is seen from below, Okay. So here if you see, you can see some of the facial bones. Facial bones are in the face. Okay. So here, these are called as the facial bones. Okay. So what are these facial bones? One of the very important bone is the mandible, which form the lower jaw bone. Okay, so here is the mandible, which you can see shown in blue color. So this is the one of the very important facial bone, the mandible, which helps in chewing. So which is also called as the lower jaw bone. Then we have the maxillary bone, maxillary bones. Here if you see here, these are the maxillary bone. Here also I will show you. So this is called as the maxilla on either side. There are two bones here. So all these bones are in pairs except the mandible, which initially was in a pair, then later it will fuse in the center. Okay. So the maxilla, this is the mandible, and this is the maxilla on either side. So maxillary bones, maxilla fuse together to form the upper jaw. So the maxilla will form the upper jaw. As you can see here, this is the maxilla forming the upper jaw. This is the mandible which form the lower jaw. Then there are palatine processes directly posterior to the maxilla form the rear part of the hard palate. So if you see here, this is the horizontal plate of the maxilla. On either side they fuse together, and this is called as the hard palate. which will form the roof of the oral cavity. Okay, so here maxilla will form the roof of the oral cavity. So this is seen from below. Now coming to the other bones of the face after the mandible and maxilla, there are something called as zygomatic bones, which are also called as the cheekbones, which will give the shape to the cheek on either side. These are called as the zygomatic bone. So these are called as cheekbones. Then we have the lacrimal bones, inferior section of the orbital bone, providing passage for the tears. So here there will be lacrimal bone on either side, which will help in the inferior section of the orbital bone, provides passage for the tears. Then there are nasal bones which form the bridge of the nose. So in the center there will be nasal bones which will form the bridge of the nose. Then we have something called as vomer. Vomer divide the nasal cavity into two halves. Vomer is usually seen from behind, so this which will form the septum. In the anterior part, that will be cartilage. From behind, whatever is there, that is called as. If you see here, this is the vomer. Okay. So it will divide the nasal cavity into two halves. Then we have the So then we have the inferior concha, thin curved bones which project from the interior of the nasal cavity. If you see here, so there are small inferior bones within the cavity, in the nasal cavity. These are called as the inferior concave, inferior nasal concave, because it is present in the nose. So these are the bones which will be there in the face. Then among them, the most important will be the mandible bone. So the mandible bone, again you'll study in detail later, but just I will show you the important structures. One is, this is called as the body of the mandible. This is the body of the mandible. This is called as the ramus of the mandible. Then we have two condyles. One is called as the mandibular condyle. Then we have the coronal process. This is the coronal process. And this one is the coronal process. This is the mandibular condyle. And here, between the ramus and the body, this is called as the angle of the mandible. So this mandibular condyle will articulate with the mandibular fossa of the temporal bone to form the TM joint, temporomandibular joint. Whenever two bones come together, then it forms something called as joint. Now coming to the next part of the face, facial bones, those are called as the paranasal sinuses. Sinus means space. So whenever there is space, then we call it as the sinuses. So paranasal sinuses, para means beside, nasal means nose. So beside the nose. So around the nose, there are sinuses, spaces. So these are called as the paranasal air sinuses because they are filled with air. So they are called as the paranasal air sinuses. So they are air-filled sacs in the bones. So there are small cavities within the bone. So these are called as the paranasal air sinuses. Paranasal because they are clustered around the and connect to the nasal cavity. As I said, they're called as para because they are on the sides of the nose, and nasal because they are around the nose. Okay, so they're called as paranasal. So they all connect to the nasal cavity. So what is the function of these cavities around the nose? One is it resonates the voice. So whenever you speak, so it will help in the increase in the amplitude and resonance of the voice. And also it will help in decreasing the weight of the skull. So if the skull is made up of solid bone, then it becomes very heavy. So and it will be difficult to hold the head up always. Okay, so you have to spend a lot of energy. Now because of this paranasal air sinus, there is decrease in the weight of the skull. So they decrease these sinuses decrease the this weight of the skull. Now coming to the The sutures. Suture. What are sutures? Okay. Before we go, do you have any questions still here? Any questions still here?
Clear, doctor.
Here. Okay. Okay. Coming to the sutures. Suture. What do you mean by suture? Whenever two skull bones come together very closely, if you see here, whenever these bones come together, so if you between the two bones, there are some zigzag lines. Okay, when it is only seen in the skull bones. So whenever two skull bones come close together, in between the joining of these two bones, there are zigzag lines. Okay, so these are called as the sutures. They are immobile, interlocking joints of flat bones of the skull. So they are immobile, means there is no movement at this level. So there is no movement at these joints, even though they are whenever two bones come together they move, but here there is no movement. So they are called as immobile, immovable. Okay, so they are immovable, interlocking joints means they lock together. Interlocking means they lock together joints of flat bones of the skull, as I showed you before. So these are the interlocking of the two bones. Okay. So they are interlocking joints of the flat bones of only the skull. Only they are seen in the skull. So they are irregular sawtooth appearance. So they look like the sawtooth. Sawtooth, the saw means which will cut the. If you have seen the wood cutter, if you see the cutting of the wood, so it is cut by something called as the saw. Okay. So if you see the saw, it will have tooth similar to that of this sutures. Okay, so they look like the sawtooth. So that's why it is called a sawtooth appearance. So the largest four skull sutures which are present where bones articulate with the parietal bone, these are called as the one is the coronal, sagittal, squamous, and lambdoid. So there are four important sutures. If you see here, this is called as the coronal suture. Then we have the parietal suture. This is called a parietal suture. This is called as the lambdoid suture. Okay, so the coronal suture, then sagittal suture is in the midline. Okay, so here will be the sagittal, then the squamous and the lambdoid suture. So these are the four sutures which we see in the skull, which are the largest. There are smaller sutures, but these are the four important largest. Then apart from that, there are small spaces within the bones in the early age. In early age, between these joining before the bones will be soft and slowly they fuse. In case of children, if you see, there will be these sutures will be very soft and the bones will be very soft and they don't fuse early. Okay, so there are small areas where the bones are not fused. Those are called as frontanels in case of children. They are present only in case of children. By the adult age, they all fuse together. So these are frontanels or unossified remnants of the membrane. So if you see here, this is one of the very largest frontanel. This is called as anterior frontanel. This is the unossified, means it is not calcified remnant and it remains like a membrane up to the age of 1.5 to 2 years. So it is present at birth and the anterior frontanel is the largest. The other frontanel, if you see here, this is called a posterior frontanel. Then we have the sphenoidal frontanel here. Then we have the mastoid frontanel. Okay, so all these are the important frontanels, but the most important will be the anterior frontanel. Why? Because it is the largest and it is called the soft spot. In case of the skull, if you see a child less than 1.5 years, then if you try to feel, if you put your finger, then you can feel softness here. So this is called as the anterior frontanel, the largest frontanel, which is also called as the soft spot. This will disappear or fuse or ossify by the 1.5 to 2 years of the age of the baby. If the child reaches 1.5 to 2 years, then it will fuse. It will ossify. Okay. So this is about the frontal. These are the unossified remnants of the membrane. Next, going to the hyoid bone. Hyoid bone, the only bone which does not articulate with any other bone. There is an independent bone in the neck, so that is called as the hyoid bone. It is movable base for the tongue, so it will be giving attachment to the tongue. This is the bone which is present in the neck. This is the bone here. This is called as the hyoid bone. Points of attachment for the neck muscles that raise and lower the larynx during swallowing. So whenever we swallow, at that time this larynx will move up and down because of the neck muscles which are attached. There are suprahyoid muscles above that hyoid bone. They are called as the suprahyoid. Then they are below. There are muscles. They are called as infrahyoid. So which will move this hyoid bone up and down during swallowing. So this is the hyoid bone which is present in the neck. Okay. I think we will stop here, and I think we'll continue with the next slides in the future class. Okay. So till here, if you have any questions, you can ask me now. If you have any questions till here, you can ask me.
Thank you, Dixon.
No questions? Okay. Okay. Thank you very much. Thank you. And we'll continue with this slide in the next class. Okay.